Dating after divorce, plus the end of the honeymoon phase could be a good thing. Everything you want to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. And here she is, our very own Dr. Leah.
Thanks, Derek. Great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, today we have a natural healthcare expert and author here to give us her best tips on maintaining an optimal sex life, but that's later. For now, let's get right to our first question.
Dr. Leah, we have a man says, I'm 36 and going through a divorce. I met my wife when I was 18, so I am at a loss for how to get back into the dating scene. Dr. Leah, do you have any advice? I know you have been married for about a year now, so you were dating up to recently into a year. Any advice for this gentleman?
Well, the first thing I would suggest is that you definitely want to wait until your divorce is final. You need to take some time to heal. Divorce can be surprisingly traumatizing and emotionally draining. Make sure that you're ready to get on with your life and not just harboring anger feelings or hurt feelings about your marriage. When you feel like you're ready, go slow. Don't expect each new date to turn into a lasting relationship, but be open for the possibility. A good way to start might be to ask a friend to set up an introduction and go on a double date.
Yeah, absolutely. And what are other ways maybe to find a good partner?
Well, ask an unmarried friend to be your wingman or wingwoman and go to some of the new hangouts around town or just get a feel for the dating scene. A good friend of mine was always complaining about being single. She still is complaining. And she never leaves her house. I'm like, do you expect Mr. Perfect to just drop through your roof and land on your couch? You need to actually get out there, right? You want to meet someone who shares your interests and values. So one of the best way to do it is get involved with activities that interest you. The biggest thing is to get out of your comfort zone and do something different, like take classes at a new gym or take a cooking class or do activities that make you feel comfortable. You want to be relaxed, and that way it'll be easier to start conversation.
How about online dating?
Well, that works too. You could look for someone with the same interests and usually talk online before meeting in person. You do want to make sure you do your research, and on online dating, you want to use a service that's geared towards your age group and the type of relationship you're looking for. You want to be aware of any scams that might target online daters.
And double check to make sure the picture is them as a really person. And by the way, the scam, you mentioned scams. What are you talking about?
Well, just like you said, catfishing can absolutely be one. So using a picture of a celebrity or somebody that isn't you. Typically you can verify if they have any social media that it is them. Other scams, it sounds pretty obvious. You don't want to send money to anybody. But the reality is about 10% of online profiles are fake. So it can be, a man posing as a woman and doing other things just to allure people into the site. So typically you can tell through conversations, but there are scammers that are out there.
Dr. Leah, a woman says, my vagina doesn't look like it used to. Are there any vaginal rejuvenation procedures that work?
Well, first I want to explain the difference between vaginal rejuvenation and vaginal reconstructive surgery. Reconstructive surgery can be complex. It involves procedures to restore or repair sexual function or organs. Vaginoplasty, where the vagina is surgically tightened after it becomes slack from childbirth or aging, is usually considered reconstructive or reproductive surgery. On the other hand, vaginal rejuvenation procedures are cosmetic or plastic surgery that mostly affect the appearance of the sexual organs.
What's an example of a rejuvenation procedure, Dr. Leah?
Well, labiaplasty, which trims or reshapes the labia or lips surrounding the vagina. It can change the size or make them more symmetrical. There's another that's perineoplasty, where they lift the skin between the vagina and anus so that it looks firmer. And there are laser procedures that will lighten the skin around the vagina and infrared pulses to make the vagina tissue firmer. There's also a clitoral hood reduction, which makes the skin that covers the clitoris smaller. Sometimes it's done because the hood is large and causes irritation, but it can also be done to increase clitoral stimulation. Finally, there's G-spot amplification, where the front of the wall of the vagina is injected with collagen, and that is in the hopes of increasing pleasure. There are some risks, by the way, to these procedures, so before you decide to get one done, please make sure to talk to your doctor about your feelings and any concerns you may have.
Very good advice, Dr. Leah. A man wants to know, what is the best type of circumcision?
Laser circumcision is the most advanced type of circumcision. It removes the foreskin from the head of the penis with a high-intensity laser beam. It's non-invasive with little pain and is an outpatient procedure that usually lasts about 15 minutes. Recovery type is 1 week, and there's little risk of infection. Stapler circumcision is another type that's only a 1-day procedure. A surgical stapler is used to cut the skin and without a lot of pain. The operation lasts about 30 minutes and you're under either local or general anesthesia. Recovery is usually 3 to 5 days and there's almost no postoperative complications. There's also the traditional procedure, which is the dorsal slit technique. An incision is cut along the upper length of the foreskin from the tip to the corona without removing any tissue. There is a prolonged recovery and a hospital stay of a few days. If it's not performed correctly, there can be some complications.
Okay, so how would the viewer know what is best for them?
Well, laser circumcision is more effective as compared to some of the more conventional methods of circumcision. Laser circumcision is performed in a day care procedure. That means you can just kind of go in 1 day and come out the next. Healing is faster and easier, and the patient can resume their normal routine within a couple of days of the procedure. But remember, nothing is without risk. Some individuals may experience some mild rashes following the procedure, but these will typically disappear in a few days. Other patients may experience severe negative effects, which could include itching or inflammation of that area of the skin.
Still to come on Sex Talk. Alcohol and sex. Coping with menopause symptoms. Signs of a hormone imbalance.
If you're having issues like low libido or issues with orgasming, it could be that glass of wine or beer. Here are some interesting ways that alcohol affects you in the bedroom.
The science of alcohol and sexual functioning involves understanding the physiological and psychological effects of alcohol on the human body. Alcohol is a central nervous system depressant that affects various aspects of sexual functioning. When consumed in moderate amounts, alcohol may initially create a sense of relaxation and lower inhibitions, potentially enhancing mood and arousal. However, excessive alcohol consumption can impair motor skills, coordination, and judgment, leading to decreased sexual performance and pleasure. It can also impact sexual desire, making it difficult to achieve or maintain an erection or lubrication. Additionally, alcohol can delay or inhibit orgasm, affecting overall sexual satisfaction. The impact of alcohol on sexual functioning varies from person to person. It's crucial to understand the potential effects of alcohol on sexual experiences and make informed choices that prioritize overall sexual well-being.
And of course, too much alcohol can cloud your judgment, so be careful with how much you're drinking. Coming up, a viewer wants some tips on lasting longer. Plus, we share some warning signs that may mean your hormones are off.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have author and broadcaster of Menopause Moments. She's sometimes referred to as the pioneer of the natural menopause movement. Marianne Stewart, thank you so much for joining us.
My pleasure.
Well, it seems that many women stop having sex at certain times in their lives, and they even say if there was a choice, they would choose chocolate over sex. I don't understand that, but what do you think's going on here?
Oh, so many things happening to women, and unfortunately, mostly they're unaware of what's going on. We're born with millions of eggs and really don't have a roadmap. So when it comes to having babies, breastfeeding, we're using up all our resources, and then we get to a point where we're firing on 2 cylinders instead of 4, and you go into what I call economy mode, and then you don't feel very sexy. Do you know, you're tired, and you may feel frayed at the edges, and the last thing you want to do is go back to where you were before in the bedroom.
Absolutely, that makes sense. So how much do we think this has to do with just the natural aging process?
Well, it does, because what our research shows is, in fact, research we did on women with PMS in the early days showed that women very often have low levels of important nutrients. So things like magnesium, B vitamins, essential fatty acids, calcium, vitamin D, all of those things are necessary for normal brain chemistry and normal hormone function. And when you're short of them, and when you have babies and breastfeed, you get even shorter. And then if you go on a diet or have too much alcohol or live life in the fast lane, as many of us do because we're so stressed and there's so many demands on us, then eventually when you get to midlife, so in your 40s, and as you approach perimenopause and menopause, you're just firing on very little, you're kind of running on fumes, a bit like a bucket with a hole in it, and you just feel terrible. And that, at that time your ovaries are winding down too, so the estrogen is falling and it doesn't feel good.
So when we're talking overall numbers, I mean, how many women do you think are having this issue as they age?
Well, it's probably the best kept secret going. Our surveys, we've surveyed thousands of women, and we found in the last survey 75% of the women say that they lose their libido when they get to menopause. It's not too surprising when 70% of them have vaginal dryness. Obviously then sex becomes painful, and it's just they become like a no-go area. And it's a nightmare because they're scared.
Yeah, so in addition to the lack of lubrication and obviously hormonal changes, what else is going on in the women's body that's really causing all this drop?
Well, you've got, first of all, the nutritional deficiencies. So then everything becomes difficult. And on top of that, the ovaries are retiring. And so whereas you had estrogen circulating around your system before and filling the receptor sites, they're now empty. And the factory that was producing all the mucus and the elasticity in the vagina and making you feel sexy just goes out of production. And women describe themselves as switched off below the waist. I mean, it's like not having sensations and having very little desire. But the good news is you can get it all back again. It's not, in our surveys, 2/3 of the women say they feel robbed of life as they knew it.
Wow, that's astounding.
This is really serious, and we did relationship surveys which show that women really lose it when it comes to relationship, and we've also surveyed men and they feel rejected and frustrated. It's just a horrible situation, and it doesn't have to be that way because the research shows that you can actually have what I call a midlife refuel and get it all back again.
I love that. Midlife refuel, I love that. So you suggested that people should ask themselves questions before really making an action plan. What are some of those questions that you suggest?
I think facing up to what's going on. And, you know, if you know what your libido is like, and everyone's different, so if yours has dropped and it's not really happening as it was, it's not so enjoyable anymore, or it's not happening, and your relationship is strained, then you really do need to take some time out. And the chances are, if that's happening, you've got other things going on as well in terms of hormone problems. It could be insomnia or anxiety or hot flushes or whatever it is. So you need to address the whole thing so that you feel well again.
So what would you suggest for natural ways through the diet to correct these hormonal imbalances?
The first thing is get your nutrients in an optimum range. That's the most important thing. So it's eating a rainbow diet. So lots of fresh fruit, vegetables, plenty of protein. If you have meat and fish, that's fine. If not, good vegetarian protein, and never skipping meals, so that you always keep everything ticking over and you're constantly having the refuel. And then obviously consuming foods that are rich in Mother Nature's estrogen. So things like soy, edamame beans, soy milk, or flax seeds. Wonderful golden flax seeds are another rich source. And to some degree, you've got chickpeas, lentils, mung beans, hummus even. There's very simple things that you can reach for that are going to help to fool your brain into thinking you've got normal circulating estrogen again. And that's really important because the molecule of Mother Nature's estrogen is so similar to the estradiol you had before menopause. So instead of thinking the receptor sites are empty and the brain going into overdrive trying to kickstart the ovaries back into function, it just thinks everything's fine again and the factory lights go on, and then you get back into having normal everything.
Wonderful. So we will be right back with more sex talk, and thank you so much.
Still ahead on Sex Talk. How long does a honeymoon phase usually last? Being in sync with your partner. Hormone imbalance symptoms. Can medications help sexy time last?
Back here on Sex Talk. Now let's take some more questions from our viewers.
Dr. Leah, we have a viewer who wants to know, how long should the honeymoon phase last? As long as possible, I imagine?
Yeah, ideally, right? The honeymoon phase is when you're just getting to know each other and everything seems new and wonderful, but you may not recognize your partner's full personality or their faults. It typically lasts about 2 years. It doesn't only happen at the beginning of the relationship. Sometimes a big life change like moving in together or getting engaged can bring back that honeymoon phase.
Okay, so what are some of the indicators that you may be leaving the honeymoon phase?
Well, it's when you start noticing your partner's faults or habits and they start annoying you. So you want to ask yourself why it's bothering you. Is it their behavior or maybe somehow how you're interpreting it? So are you arguing a little more? If you are, it may be a sign that the honeymoon phase is over and you and your partner need to speak out a little bit more about what's bothering you.
You didn't mention anything about maybe a lower sex interest in each other, perhaps also? I imagine that's part of it.
Yeah, I mean, that is absolutely part of it. When you're less attracted to somebody, I mean, if everything they're doing is annoying you, then you're going to be less attracted to them.
All right, okay. Anyway, it doesn't sound like it's fun leaving the honeymoon phase, but it can't be that bad if it's a natural way to leave, correct, when they leave?
Yeah, I mean, it is natural, and it isn't for everybody. Not everybody actually leaves the honeymoon phase, but most people do. When a relationship is new, you want to spend as much time together as possible. But as it develops, you might find yourself wanting to spend more time with family or friends. And that's not a bad thing, because healthy separations or different interests can actually be good for a relationship. You and your partner might stop acting on your best behavior and you might want to feel a little more relaxed with each other, and that's okay. One of the best things about the end of the honeymoon phase can be an increase in security. You shouldn't freak out about the end of the phase because it could be the beginning of a more lasting and honest relationship.
Okay, so how long typically does the honeymoon usually last? You said 2 years earlier. I mean,
yeah, typically it's 2 years. For some people, it might only be 1. But typically 2 years.
I guess it depends on the relationship. You know, what should couples do to keep the relationship alive and exciting when they're over the honeymoon phase?
Well, biggest thing is don't panic, right? We understand that it's normal and it's natural. Talk about sex if, in fact, your sex drive or the amount of times you're having sex is decreasing and that's bothering you, right? So if it's bothering one person and it's not bothering the other, then you need to communicate about that. But if you're really busy, and a lot of times that happens, find a way. Like, we all have to shower together, right? Really important. Prioritize something new together. Try something new, right? So all of these things are incredibly important. Like, I'm obsessed with the ocean, and that is where I find my peace, and I love socializing on the beach and doing all of those things. My husband finds the beach really boring. He likes to golf. I think golf is dreadful. But there's really, like, sometimes you have to focus on the relationship, and, you know, I don't always go to golf with him, but a lot of the times I do, and he typically goes to the beach with me. It's just really about the importance of still spending that time together.
Doctor, do you think that maybe the longer a couple dates before they get married, the honeymoon phase maybe lasts a little bit shorter?
Well, so the initial honeymoon phase may have died after that year or two, but then when they start to prepare for the wedding, a lot of times people get excited and they start to feel that honeymoon phase again, but then it might die off again right there. So it's these big, exciting life changes people like, and you're really happy with your partner, but you might need to understand that it's only because of this. Like, I've actually seen instances when couples were fighting and then the guys proposed, or if the guy messed up and then he just proposed and everything seems wonderful for a while, but if you're not addressing the actual problem, then it's gonna go back.
Dr. Leah, a woman says, I've only had an orgasm with a vibrator. What can I do to have one with my partner instead?
First off, don't feel guilty or think that it's wrong that you can't orgasm with your partner. Many women find that it's hard to climax with just penetration. You can retrain your nerve endings to respond to different stimulation. Use your vibrator to get to the point of orgasm and then switch to your partner near the end of the climax. Then try switching a little bit earlier each time.
Okay, so what else can the women do? What can they do?
Well, ask their partner to hold the vibrator while giving you oral sex. Or there are vibrators that strap on, so you don't even have to worry about it getting in the way. You should also try not to focus so much on reaching orgasm with your partner. Enjoy exploring each other's bodies and relax. That will reduce any pressure that you might feel, which could be part of the reason that you can't orgasm.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to AskDrLeah.com.
If you have issues with your skin or even trouble sleeping, it could be your hormones. We have some everyday symptoms that could be red flags.
When our hormones are imbalanced, it can lead to a range of symptoms that may disrupt our daily lives. Hormonal imbalances can significantly impact mood and emotional stability. Experiencing frequent mood swings, increased irritability, anxiety, or persistent feelings of sadness may be connected to hormonal disruptions. Hormone issues may lead to a decreased libido, difficulties with arousal, or other sexual dysfunctions. More symptoms that could be a result of imbalanced hormones include skin issues, sleep problems, and weight fluctuations. Being aware of the signs of hormonal imbalances empowers you to take proactive steps toward addressing them. However, it's crucial to consult a qualified healthcare professional for an accurate diagnosis and personalized guidance.
Women may also experience changes in their menstrual cycle that could be rooted in hormone imbalance. Those signs include irregular periods, heavy bleeding, or even intense PMS. Now let's take on some more questions.
Absolutely. A male viewer says, I'm 48 years old. I'd like to last longer during sex. Are there pills that prolong ejaculation effective? And are there any sort of long-term side effects from taking them?
Well, medications for erectile dysfunction like Viagra, Cialis, Levitra, and Stendra can prolong your erection and might help with premature ejaculation. ED drugs can also help keep you erect after you ejaculate and allow you to continue having intercourse. They do come with some side effects like headache, indigestion, facial flushing. Stendra is less likely to cause these effects. Some of the most common antidepressants are another solution. They are serotonin reuptake inhibitors and can also help prolong ejaculation.
Okay, but how long do they take to work?
Well, Viagra takes about 30 minutes to kick in and lasts 4 to 6 hours, whereas Cialis can last much longer, sometimes up to 36 hours. Stendra takes only about 15 minutes to be effective, and it can last up to 6 hours.
Yeah, I think most men would trade the side effects if they could last longer, so I don't think it'll be a problem, the side effects.
Yeah, most men have that as a priority, absolutely.
And what else works, Dr. Leah?
Well, there are other things you could try, such as creams or sprays that reduce the sensitivity to your penis. You want to put them on the tip of your penis about 30 minutes before intercourse, but you want to make sure to rinse it off before you have sex so that the numbing agent doesn't affect your partner. Also, think about changing positions more. That will help you take a break and slow down your movements. If you want to prolong sex so that your partner reaches orgasm, try spending more time on foreplay, like oral sex or even toys, which can make you both climax around the same time.
You know, he says he's a 48-year-old male. Not that he's old or anything, but let's just say has nothing to do with his ability to have an erection or maintain it or have an orgasm quicker. What if he just gets exhausted, he tires out?
Well, if it has nothing to do with the penis and it's just your actual body, then engage in exercises that work the muscles that you're using in bed. So predominantly, legs, hip flexors, so quadricep, hamstring, hip flexors, glutes, core, erectus abdominis. So you want to make sure that you're working all of these muscles so that you're not getting too fatigued.
Well, that's great advice. A viewer wants to know, can you get STIs in your mouth? How do I know if it's an STI?
Well, some of the common ones that affect your mouth are herpes, gonorrhea, syphilis, and HPV. Herpes can be spread through sexual contact with someone who has the infection, even if they don't show the sores. They appear as one or more blisters around the genitals, rectum, or mouth, and they may take a week or more to heal.
And how about gonorrhea?
So gonorrhea is usually transmitted through sex, and symptoms can be burning sensation and throat pain. However, most people don't have any symptoms.
And what about syphilis, the other one you mentioned?
Yeah, well, you can get syphilis through direct contact with the sore of an infected person. And symptoms are typically things like sores on your lips, tongue, and gums, anywhere around the throat, but that one is less common.
And you also mentioned HPV, correct?
Yep, so HPV, or human papillomavirus, is actually the most common sexually transmitted disease, and oral HPV is transmitted most commonly through oral sex. So it can cause a type of cancer that affects the back of the throat, including the base of the tongue and tonsils, and an estimated 70% of throat cancers are attributed to HPV, with about 13,000 new cases each year.
That kind of sounds kind of scary, you know.
Well, it's common, it's out there, but in most cases, your immune system clears the HPV virus within a year or two. But there are many types of HPV and types like 16 and 18 that can remain dormant for years before precancerous cells appear. Good news, don't be too nervous. The cure rate is that 85 to 90% are cured over 5 years. And again, we have a vaccine, so get out there and get it. Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you always wanted to ask on Sex Talk.